Hi everyone, I am Dr. Waseem, and today we will discuss the most important and the most confusing topic of musculoskeletal radiology, and that is the difference between osteoporosis and Paget disease of the bone. How on imaging and specifically on radiographs we can tell that the disease is Paget disease or it is osteoporosis of the bone. Basically, the both diseases are due to defect in osteoclasts. We all know that osteoclasts are the cell which are responsible for bone resorption. In Paget disease, there is a metabolic defect inside the osteoclasts which overactivates the osteoclasts and causes bone resorption. And in Paget disease, there is a developmental defect in osteoclasts, and osteoclasts do not properly perform their function. So it is very interesting that the result of both these defects overlap. When there is defect in the osteoclasts and there is no resorption of the bone, there will be uninhibited bone formation and there will be osteosclerosis. In Paget disease, when there is overactivity of the osteoclast, there will be bone resorption. As a result of bone resorption, there will be bone formation and osteoblasts activate, and this activity of osteoblasts causes osteosclerosis. So the bone shape which appear in both diseases is osteosclerosis. But the mechanism behind this osteosclerosis in both diseases is different. So in imaging, sometimes it is difficult to distinguish whether this osteosclerosis is due to Paget disease or it is due to osteoporosis. First of all, we will discuss about the Paget disease of the bone. We already discussed that Paget disease is a metabolic defect inside the osteoclasts, and osteoclasts are overactivated. Why osteoclasts are overactivated? There are different theories, and it is believed that viral infection, especially the infection with paramyxovirus, is believed to be the cause of Paget disease. So Paget disease of the bone has three phases or three stages. In first phase, there is overactivity of the osteoclasts, and as a result there is bone lysis. And if we image the bones during this phase, there will be osteopenia and bone lysis. Bone density will be decreased. Then there is mixed phase. After osteoclast activity, osteoblasts are activated to form the new bone. This is the mixed phase of the disease, second phase, in which there is osteolysis and osteoblast activity, both are going parallel, and there are some lytic lesions and there are some sclerotic lesions we see if we image the bones during this phase. And the last phase in which usually the imaging is done is the sclerotic phase. It is also called cold phase, in which the activity of osteoblasts surpasses the activity of the osteoclasts. It means that the bone formation is more than bone lysis. As a result, there is generalized osteosclerosis of the bones. So, if we image the different bones in osteoporosis, there is specific appearances. For example, if we image the skull bone, then there is a specific appearance of the skull bone in which there is lysis of the skull vault, and this lysis is more prominent in the frontal and temporal zones and more prominent in the outer table of the bone. The inner table is preserved, relatively preserved in Paget disease of the bone. And this specific appearance which appears is called osteoporosis circumscripta, is the terminology which we give to the appearances of the skull which appear during the different stages of the Paget disease. In the end, there is sclerosis of the base of the skull, and when there is sclerosis of the base of the skull in Paget disease, definitely the foramina through which the cranial nerves are passing are narrowed, and as a result the cranial nerves are affected. When the cranial nerves are affected, we can have symptoms of blindness, we can have symptoms of deafness. These are due to basically impingement of the cranial nerves due to osteosclerosis of the skull base. And after the skull, if we image the vertebra in Paget disease of the bone, there is specific appearances. And the most common appearances in vertebra, we see that there is picture frame vertebra. Picture frame vertebra is that the superior and inferior end plates are thick, and there is osteosclerosis of these end plates. In between these end plates, there is spongy bone. So, a picture frame appearance of the vertebra appears. Similarly, if we image the long bones in the Paget disease, there is thickened bone, especially along the metaphysis, because metaphysis is the region where the bone growth is prominent, and metaphysis of the bones appear thickened, and we see radiolucent and radiopaque lines in the metaphysis. These lines are due to the cyclic activity of osteoblasts and osteoclasts during the Paget disease. So these are the main organs whose imaging is important when we want to diagnose the Paget disease. First, that is skull. There is osteoporosis circumscripta. Then there is osteosclerosis of the skull base. When we image the vertebra, there will be picture frame vertebra, and their long bones appear as there is a flame shaped appearance of the bones. Metaphysis is thick and sclerotic, and the rest of the bone is relatively thin and tubulated. So if we compare these findings with the osteopetrosis, in osteopetrosis there is defect inside the osteoclast. When osteoclasts cannot perform their function properly, there is continuous bone formation due to activity of osteoblasts, and sclerosis appears. If we image the skull, osteopetrosis, then the skull base appears thickened, just like in we already discussed in Paget disease of the bone. There is also skull base sclerosis in Paget disease and also in the osteopetrosis. Then how we differentiate whether this skull base sclerosis is due to osteopetrosis or it is due to Paget disease of the bone? Then we see the skull vault. In Paget disease, the skull vault show some areas of lysis and some areas of osteosclerosis, and the inner table of the skull is preserved. As a result, a cotton wool appearance of the skull. But in osteopetrosis, there is no lysis, the skull vault is thickened, and there is a rough and thickened and coarse appearance of the skull vault. Now, if we talk about the vertebra, in osteopetrosis, also there is superior and inferior end plates are thickened. Inside these superior and inferior end plates, there is lysis. There is not much thickened bone. The end plates are more thickened. But in Paget disease, there is picture frame appearance of the vertebra. End plates are thickened, but the spongy bone, there is lysis of the spongy bone. So that's the difference between the vertebra of the osteopetrosis and Paget disease of the bone. And if we talk about the long bones like tibia and femur, then in Paget disease we already discussed there is metaphyses are thickened, other bones are relatively tubulated and thin. Along the metaphysis, there is radiopaque and radiolucent lines showing cyclic activity of osteoblasts and osteoclasts. But in Paget disease, unlike Paget disease, in osteopetrosis, we see a titration flask or conical flask, also called Erlenmeyer flask deformity inside the long bones. And what is Erlenmeyer flask deformity? In this, the ends of the bone near the diaphysis At the junction of diaphyses and metaphyses are thickened, they are wide, and the rest of the bone is tubulated and thin, giving the appearance of Erlenmeyer flask. So these are the basic differences with the help of which we can differentiate between the Paget disease and the osteoporosis. But in both diseases are due to defects in osteoclasts, and in both diseases the end result is osteosclerosis.